Hey y'all, hey, happy Monday, happy Memorial Day. Lord, finally about to get out the house to go with my cousin, but I'm looking at this temperature and it says 96. I don't know how your girl gonna do it. If you are new here, welcome, welcome, welcome. And if you're a returner, welcome back, my baby. Welcome back. It is me, her, yes, your girl, the one and only Pretty Nikki. Yes, it's me. I'm here for a little while, not a long time. Okay? I'm here for a short while, not a long time. I'm trying to see what battery is the lowest. Maybe it's this one. We'll see in a second. Maybe it's y'all. Maybe y'all the lowest battery. I don't know. Check myself. Y'all not the lowest battery. Y'all are not the lowest battery. No. This. It's pretty good. That's gonna stop me from drinking a cold drink. Some people may call it sodas or coolers or colas or whatever, but baby, the heat got me calling it a sparkling water is what it is. But nah, for real, let me stop playing. Yeah, cold drinks. This sparkling water right here gonna stop me from drinking a cold drink. Because Lord knows, I'll definitely be up on one. When I tell you, they need to just pressure wash because I'm sick of the spider webs. I'm so sick of the spider webs. And they need to come if they're coming. Oh, and they must want to turn it, don't know how. It's okay. I'll go first. I'll definitely go first. I know they just dumb like that. I know they just dumb like that. Baby, I had to sit down and settle down and relax myself. I had to relax myself. My ear itchy. But I'm gonna come back on here when I get my cousin up because right now it's just not it. Baby, I did not make it into the outdoors. It's too hot. Oh, she was supposed to make some? That pan is empty. I didn't make it past the outdoors. I went outside. I made it inside. Went outside one time. And that was it. Don't request nothing from me because I ain't asking you for your cash share. I already bought you a gift. Huh? My cash app don't work. I got everybody on block. I went down my cash app and blocked everybody I could think about knowing. Watch what happens. Watch what happens. Okay. And it served me no purpose at all. Inside. Girl. Oh, I'm still up in here watching the last Bad Boys movie. I'm hot. I don't know. Yeah, y'all. Me or they. I was supposed to come back on yesterday, but they had a lot of music playing, so I couldn't just, be up on here like I wanted to. I couldn't just be up on here like I wanted to. So I had to, yeah, a lot of music playing. It wouldn't have worked out. My nose itches. I don't know what it is about outside. I don't know what it is about outside, but when I tell y'all my nose itches, my nose itches. My nose be itching me down. My nose, my eyes. Ooh, my nose more. Oh my God, more than anything. But anyway, Yeah, I didn't come back on yesterday because, baby, the music was musicking. The music was musicking, and I just couldn't. I couldn't make it back. But I'm here today. Girl, I'm here today. I need to fix this. I need to fix this because I'm on my way to my endocrinologist. But I don't need to go there looking like, go in there looking like this. Not looking like this. Like this. Baby, I'm already looking and there's no parking spots. When I tell you, I leave early to come here to find a parking spot. But baby, there is never a parking spot. There is never. Oh yeah, baby got me a parking spot right here though. I saw the man in his car, but I guess he was like me, waiting on the people to move, so he can move out of the spot, so I can move in it. Okay. Baby, I think I'm all the way crooked. Let me see. I'm actually not. I'm straighter than I thought I was. I'm just a little bit old. Not straight nowhere. No, I'm not going nowhere. You can go ahead. I was fixing my wheel, baby. What they throwing? What they throwing? I'm not going nowhere. They didn't thought I was going nowhere, huh? They must have thought I was going somewhere. I'm not going nowhere. I'm not going nowhere, but what I do need to do is pull these little hairs up. I need to pull these hairs up. I need to pull these hairs up, baby. Yay. And as we know, however it lands, once I put my tie on it, that's how it's gonna be, right? Right. However it lands is how it is, baby. Okay. Now let's clean these lenses. Let's clean these lenses, my baby, because they're zoiding. Let's clean these lenses because they're dirty. Yo, I need to get my life together because I know I didn't say it more than one time, but I'm going to keep on saying it. I need to be on here more often. I need to get on here more often so y'all can see. We having to clean the glasses. We had to reach into this bag to see what was what, because we need some chapstick on. But I'm about to go to my endocrinologist. So we can talk about this labs and this little test that was given to me, because I don't really know how to read it, but I'm gonna try to go into it to see if y'all can see any part about what it said. Like, why is it not closing? Maybe go down, because we don't need that to occur. As I told y'all before. First is chapstick, and then it's lip gloss. Chap Van Gloss. Oh, but let me see. I want to check real quick to see if I could tell y'all like the result thing. Login Face ID, period. She always logging in with her face all day. Girl, I been did the e-check-in. I know this thing ain't. Girl. Yes. Next. Girl, I know y'all lying to me. Next. Submit. Submit. Okay, all that was on there. Submit. I don't have to modify anything. Submit and continue. Next. Submit. E-check-in for one of 2 visits. Now, why would I have to do an e-check-in for that visit too? Oh, test results. So they did a TSH, they did the LCMC T4 free, the basic metabolic panel, the hemoglobin A1C, the lipid panel, and this other one is a dexamethasone, whatever suppression test, DST1 specimen. It says fasting, yes. Whatever the test for 8 a.m., 2.0 normal response, whatever equivocal 10 high probability of Cushing syndrome. Further diagnostic tests must be performed to confirm the diagnosis and determine etiology. Values of of greater than 2.0 micrograms a deciliter can be seen in endogenous depression and pseudo Cushing's. So let's see. Cushing's syndrome. Let's see. Oh, I gotta go. Anyway. What is Cushing syndrome? Cushing syndrome is a hormonal disorder caused by prolonged exposure to high levels of the hormone cortisol. This can be due to body's own production of too much cortisol or from taking corticosteroid, whatever medications. Common symptoms include weight gain, particularly in the face and trunk, thin skin, and muscle weakness. Oh my God, elaboration. Cortisol's role. Cortisol is a hormone that helps the body respond to stress, regulate blood pressure, and maintain blood sugar levels. Cushing syndrome can be caused by pituitary tumors. These tumors produce too much ACTH, which stimulates the adrenal glands to make more cortisol. These tumors directly produce excess cortisol. Tumors elsewhere in the body. Some tumors cause ACTH or other submissions and can cause adrenal glands to produce too much cortisol. Cortisol medications, long-term use of high doses of cortisol drugs can also lead to Cushing syndrome symptoms. Weight gain expeditiously in the face, on face, trunk, and back of the neck, buffalo bump, thin arms and legs, muscle weakness, fatigue, high blood pressure and blood sugar, easy bruising and slow wound healing, purple or pink stretch marks on the skin, mood changes such as depression, anxiety, and irritability in women, irregular periods, excess facial hair, and acne in men. Oh my God. Oh my God. Bye, y'all. Yo, what I just finished reading, lies and garbage. Cause who? Definitely not me, love. That bone, that knee hurt here. When I tell you that knee hurt, The knee is hurting. I'm trying to fix it so it don't be sitting so bad. Let me see. I'll put that right there so it don't move. So I'm fixing my straps. And the knee brace. So it will be this one. Fix it first. And then this one. I think you go like that. So you're having shucks. I know it's supposed to be on there for to support my knee. So period. Okay. Yo. What I was just reading, I don't know what it was, but nah. I don't know, like I don't get it, I don't understand it. None of it. I don't get it and I don't understand it at all. Why my thing feel like it's okay. Like it was choking me in the front. But I don't know in the back. They about to be coming to the door real quick. Real quick, real soon. So I don't know. Me and her gonna really have to talk about it because me and the dietitian was talking about it. So me and her gonna have to talk about like what it is, what's going on. I like this polish, but I don't like this polish. Maybe it should have been a different one. It would have looked differently. Like I like the fact that it looked like it could be glass, but then again it looked like it's I don't know. I'm sure I can really see what I'm talking about, but see? Yeah, see it? Yeah. Was just the ugliest hand that I'm showing y'all, because this is the left hand that I did with the right hand. Oh, baby. And it's a whole mess. It is a whole dang on mess. I'm gonna get the file and like file down around this area. I'm just scared that I'm gonna cut myself or hurt myself. But it just means I need to put on a different drill bit and go back around the sides. Around the sides with a different drill bit. Like if I could just get right down and file right here properly on the sides. Down here is fine. But this one is like down here. Y'all don't care, huh? I know. I know. Y'all just want to be in my business though. But y'all gonna see the business y'all gonna be in when I get up on this scale. Be in that business. That's the business I need y'all to be in. And if I say anything other than with my scale at my house seed, they're gonna have to get a new scale. They're gonna have to get a new scale. Period. Why she laughing sounding like a hyena? Why? Why? The whole fake that? Let me sit up properly. I don't know, y'all. I just don't get it. Just don't understand. So weight is what it is. There what it was on my scale at home, 272.3. We need to get in the 260s so we can fluctuate over there for a couple of months and then keep on working our way down. Then we get into 250, so on and so forth. But anyway, I've been stressed over my blood pressure. Crazy, right? Stress, blood pressure, not a good combination. Because like I have been having these real bad headaches. And the little blood pressure thing I have at home, I could not get it to come on right for nothing. So I was like, maybe the batteries need to be changed. So I told my brother yesterday, I was like, oh, give me some AA batteries out of Family Dollar. And then when I got home, I was like, why needed AAA batteries? The one that I had before that go on your arm, I think I gave that one to my mom. My dad one take AA batteries. But I have hers, the one that go on your wrist, and it takes AAA batteries. I'm like, Lord, why? But as far as this Dex, whatever, the Somosome test, that pill that I took the test for, it said that it was normal, but it was saying some further testing could be done for something else or whatever. So we're gonna see exactly what she says, because that's just what I read, like from the results that came from Quest or whatever. But we're gonna see exactly what it is, because guess what? The devil is a lie. The devil is a whole lie. You know what I don't like lately? I could real life really see my veins in my arm. I never been able to like see my veins like sticking out in my arm like that. I don't like that. I'm seeing her today, but y'all gonna be with me again when I go to the doctor on Thursday, because Thursday morning for 7 o'clock I go get my mammogram, and then I go see my primary care physician, and that's gonna be for my yearly wellness visit. So trust, I'm a girl that always goes to the doctor, always going for anything and everything. Men don't go to the doctor like they're supposed to, which they should. Which they should. Go to the doctor. Go to the doctor. Because why we not going? Go to the doctor, pay that copay, do whatever it is that need to be done. See a doctor that's in network. All of that other good stuff. Go ahead. Because why not? But I also want to remember to ask her if she can get me a podiatrist, which is a foot doctor, because the one that I was seeing at the old clinic that I was going to, I won't see nobody around there. And then when I looked up on their site to try to see if I could find one, it was giving me one for like one way across the river. So I'm not going all the way across the river to see a foot doctor, and the exam don't even be for 15 minutes. I'm not doing it. That is what I'm not doing. I ain't being cute though. Y'all see me? Yeah, y'all see me. Period. Stop playing with her. I'm just playing. I'm being silly. I'm being a little silly goose. A little silly goose. Baby ain't going there before that time. Going home and put on some other kind of shoes, like a little tennis shoe or something. Or a pair of tights. Go put on a pair of tights and a t-shirt. And let it be whatever it's gonna be. Yeah. That's what's gonna happen. Y'all miss me? We're gonna be back when the doctor come back, because I know y'all won't hear me rapping. Just chapping. Just chirping. Y'all won't hear that. Y'all won't see my little knee? Y'all see? And call myself wrapping it up, putting a little thing on it or whatever. It probably should be down somewhere else on here, but I can't never get it fixed the way I really want it to be. It's okay though. It's not hurting when I step a certain way with having this on it, and that's how it needs to be. Not hurting. I need it to be not hurting. She was like, "Are you any other kind of pain besides what you coming to see the doctor for today?" I said, "Yes, money." And on a scale from 1 to 10, how much pain are you in? I said, "Well, it's not consistently, but when I step down and that pain hit, it's like a 7." She was like, "A 7? It's a 7. Baby, that thing feel like it just won't come clean from under me. Clean from up under me." What y'all got? Cortisol shot y'all could give me? Somebody give me a cortisol shot. A cortisol shot in his knee. So I go hit on and I could work out. I'm being silly, but I'm very serious. Because I was like, every time I really say that this is what I'm about to go do, I start having this kind of pain or that kind of pain. It's crazy. But yeah, I know I was told that I was thirst trapping because I post my pictures on social media. They said it's thirst trapping. How? How is me posting pictures thirst trapping? I want to be cute. I want to be looking cute. I had a pain that was right here on yesterday. I don't know what it was. When I tell y'all this right here was hurting, it was right here. It was hurting. I said, oh, it felt like, you know how when you pull a little muscle or something right there? I go from over here to right here. I don't know, but the pain gone. It was right here. And it was hurting. I was like, Lord, do it for me. Oh no. What if you don't do it? It just won't be done. Do it for me. Baby. So it says diagnosis involves blood tests to measure cortisol levels in scans to look for tumors and other tests to determine the cause of excess cortisol. Treatment depends on the cause, for example, surgery, therapy, and radiation therapy. Occasion to reduce cortisol levels. Maybe the devil is a lie. Yeah, spam risk. Baby, go ahead on about your business. Does it? Yes, master surgery and reloading, especially when the underlying cause is addressed. In most cases, individual percussion syndrome can be cured or at least have their symptoms significantly managed. Treatment and potential for resolution. Baby, what is life? How do I find out if I have? What happens if Cushing's disease goes untreated? What does a cortisol belly look like? How do people with Cushing's feel? Oh, child. A cortisol belly or stress belly primarily refers to weight gain concentrated in the abdominal area, particularly visceral fat, which is the fat surrounding the organs. It's often associated with elevated cortisol levels, a hormone linked to stress. Visually, it's not a distinct shape, but rather an increase in abdominal fat, which can lead to a more prominent belly and a noticeable shift in body shape. Stop playing. Here's a more detailed breakdown. No specific shape. Cortisol belly doesn't have a unique appearance. It's simply an increase in abdominal fat similar to other forms of abdominal fat. Visceral fat, the fat in the abdominal area, particularly visceral fat, is often the focus when discussing cortisol belly. Apple shape, the body shape may shift towards an apple shape with more weight in the upper body and abdomen as opposed to the pear shape with more weight in the hips and thighs. Say you're soft. Some individuals describe the fat as feeling soft or looser, potentially appearing more saggy or hanging over the waistband compared to the area of the body.
Unexplained weight gain. Another characteristic of a stressed belly can be unexplained weight gain, particularly in the abdomen, even with consistent healthy habits. Other signs, besides the physical appearance, other symptoms may include anxiety, depression, easy bruising, muscle weakness, stretch marks, high blood pressure, and elevated blood sugar, according to WebMD and Health.com. 3 tips to get rid of stressed belly. Cortisol belly, what it is, causes cortisol belly, what it is, cortisol belly signs, causes, and how. Baby, stop playing with me. Y'all probably been looking at the ceiling for the longest listing.
Okay, and the next appointment in 4 months?
4 months. Mm-hmm. Okay. Baby, that little lady was funny. I need to go check out this. It was hilarious. How you doing? Oh, that's so nice. He walking with a cane and got all the way off the sidewalk for me to walk past. That's what you call nice. See, people ain't nice like that no. I need to get my phone, boo, and call this pharmacy. Let's see what it's hitting for. Girl, I am hurting like a dog. What's my knee hurting like this? Oh, shit. Baby. They got a spot right there. Oh, they got spots all the way down there. See, when I came, they didn't have all them spots. But they got spots now. They better go sit down somewhere. That's what they better do. Ooh-wee. Oh, shit, y'all, my fucking knee. Excuse my language, man. When I tell y'all that knee is on fire, baby, that knee is on fire. That knee is on fire. Hey, y'all, hey. Look, so we are on our way to, it should have been our last doctor's appointment out of all of them there was, but baby, this morning when it was time to go for my mammogram, it was storming, and every time I tried to call, I was getting the messages like our office is closed due to the weather and all kind of stuff like that. So getting ready to go for this appointment, the people called me at like 8 hey, I was calling you about your appointment that you were supposed to be here for 7 a.m. Baby, when I called, it said that your office was closed due to weather. So my appointment was 7 a.m. and y'all didn't open till 7 a.m. How does that go? Because how is my appointment at 7 and y'all open at 7, but y'all weren't open at 6:40 something when I was trying to call, 6:30 something, whatever time it was. But y'all wasn't open, and the only reason why I was that late when I was calling was because it's not no more than like 10 minutes away from my house. So we rescheduled that mammogram for tomorrow for 9:30. Tomorrow for 9:30 for the mammogram. So I'll be there for that. But if I get up on time in the morning, since it's not till 9:30, I could do orders from 6 to 9. I could do all my orders from 6 to 9. But I'm going to take my Sambas off when I leave my appointment. I want to go do orders first. But baby, if I roll up to somebody's door and my shoes get messed up, I'm going to be upset. I'm going to be very, very upset. I'm going to go and throw on the little New Balances. The little New Balances. I got to get my little purse from my mama. What are you looking at, sir? Baby, I know the change in the weather, but baby, the air is all the way turned up. It is cold up here. It is like turned up. I had to turn it off. The good thing about the whole mammogram appointment is that I woke up this morning and I had to put on. I can't function like that. Yeah, we're gonna work on this nail situation. We're gonna keep working on these nails till we get them right. We're gonna keep working until we get it right. Cause that's the only way to make it work, right? Is to keep working on them till we get them right. I'm trying. I'm gonna keep on trying too. But like I see how the people be doing their nails and it just be so thick, and I be like, I know that they're not real nails, but why? Why are we doing this? And then I see how they have the stuff where they use like the I forgot what you call it, but you could use the thing and build a nail. I ain't built like that yet. Your girl is not built like that yet, baby. I would be 24 hours doing those nails. I would. I'd be 24 whole hours trying to do those nails. I just gonna say, I'm driving. I'm not driving. I'm not driving. See why I don't use the phone to drive? But I'm not driving. I'll be back. Today we are here to see Dr. Joseph. She is my primary care physician. Tomorrow we're gonna go ahead and take the little mammogram and get it on out the way. I don't know what to do with this hair. It's so much, it's growing like crazy. It's long, way long. And yeah, I don't know what to do with it. So I used to wear it all pulled to the front, but I can't wear it like that no more because it like okay, so like the way I would wear it all to the front used to be like this, and it would be like all in my glasses and everything. So we're gonna wear it on over to the left side. We're gonna fix it on up like this here. Have the little pony. It's fine. It's just a ponytail. We just need to have the hair not hanging on us. Because I also have a tie on my wrist, because if this gets too hot when I get out and make orders, I'm going to take it and pull it all the way up in the bun, period. We don't do hot hair. We do not do hot hair. But I'm also about to take this air piece out my ear. I found them, y'all. They was under the seat. I was searching high and low, looking all over the place for them. Under the seat of my car. I was like, I know I put this in the, I was like, I know I put this in my pocket. I know I had it with the little dress that I had on I thought it was on Tuesday when I went to my other appointment, and I was looking for them and I could not find them anywhere. But we are here for a wellness visit, wellness checkup, whatever you want to call it. And like the insurance with your job, they normally like require it at a certain time, but for whatever reason, like, oh, my forehead is shiny, baby. What they have pulled up like that. Oh, wait. Oh, they have pulled tight, baby. That forehead is shining bright like a diamond. Okay. Damn. Wee. Anyways, I'm still cute or whatever. Girl. My Sambas. This is the one that JC spilled that milk on. But this looked like a piece of the leather. Can I see my shoes? And most people are like, hey, yes, girl, this is the shoes. Girl stained my shoes with chocolate milk. Y'all see this? See it. She stained my shoes. Girl, I'ma see. I should be able to get a little wipe or something and wipe them off. Yeah, got some sanitizer in here. Baby, we got to get that off of there. That's not cute. These shoes are brand new. My shoes are brand new. And I don't like it. But I do need to pull my pants sleeve down some. Yesterday, my mom told me, you got socks on? Of course I have socks on. She was like, 'cause I was about to say, your skin got some light. Girl, no, that's not my skin. You know why that stuff still on that shoe right there? Because the shoe she wasted it on was my left shoe, and it still got a stain on the little suede part of the shoe at the front. But I didn't know that it had splashed and got on that shoe too. Some daggone chocolate milk. Boy, you gotta let these churn you up. But baby, that you need to get it together. You need to get it together. Period. Period. Boo. I'm gonna come back when she come in.
That would be a reason why. Hello.
Good morning. How are you?
Oh, you smell so good.
Thanks.
Oh my goodness. Is that shower?
No, that's one of the alien. I forgot.
Oh my
the name
God,
of
it smells so
one of
good.
those.
It's giving. I think it's nostalgic for me because it kind of smells like. Remember that powder that was like shower?
Yeah, I know what you're talking about.
It
Yeah,
smells just
I
like
know
that.
exactly
I
what
used
you're
to love
talking
my
about.
okay. Just
Yes.
powder down. Okay, here for your wellness.
Yes.
Okay, awesome. How are you doing in terms of your diabetes?
Sport. And it was like late, so I was like, I had 2 slices.
You're better than where you were.
Oh, wait, but a lot better than where I am with the weight loss and everything.
So you just gotta keep going. And keep challenging yourself.
I have to.
That's the hard part, because you're like, dang, this used to be all I needed to do, and then all of a sudden it's like, and you're like, oh shoot, that means I gotta push a little bit more. Because you've leveled up.
Because it's like, okay, I did this, so now what? But I was like, okay, so I did this, I'm losing the weight, and I got this part right here, so now I'm looking at myself, I'm like, you know what, I am, but I'm like, I don't like my legs, like, everything is smaller, but like, it's loose, and I don't like the looseness. I'm used to always having a more toned legs, like, it's always been toned.
Yeah, and that's the thing with those, like, and sometimes Mounjaro will help you. Okay. Okay.
So, you know, and I also know that knowing and doing is 2 different things. So now that I know it, I need to make sure I do it. Yeah.
Doing it is the harder part.
Yeah.
For sure. Because, you know.
Because I tire myself out so much with doing the other stuff, and it's just like, oh, I'm tired of it.
I know.
Like, well, girl, like, you don't just.
What time did you start?
Since school just got out, so like I'll get up like the early morning time and try to do like that 6 a.m. to 10 a.m. because it's like a 4 hours time slot. I'll do like 6 to 10. But I was like, maybe if I could just get up a little bit early and I could go to the gym first and then go right over there and just keep my weight just like that.
That's to be your like
even the elementary kids now.
Yeah,
The primary kids, yes.
Really?
Yes, the mom.
Don't even get me started. I didn't even know we didn't have sick days. I was like,
y'all have sick days? Girl, I would be sick for no reason.
It come out your vacation bundle. So I'm like, either you go on vacation or you sick. You can't do both.
But you know, now that I'm thinking about it, when I worked for Oxnard, we didn't have sick days. We had that time, but we did not have like no particular sick days.
So when you sick, I'm like, well, what if I'm sick and I already took my vacation now?
Yeah.
Anyway,
right there when you come out the door.
All right. She wants you to cancel your June appointment.
Yeah.
And we're going to make that a 6 months. So what I'm going to do, I'm not going to cancel. I'm going to reschedule.
Yeah.
So let's get into your file and let's fix all of this. Miss Jones. Six months takes us to Monday, December 1st.
Okay. Can we have a Friday?
Absolutely, of course we do.
Late evening, as late as possible?
Friday late evening, we can go to December 5th.
Okay.
Because the Friday before that is the day after Thanksgiving.
Yes.
She's off.
Yes.
The latest appointment is at 3:15.
That's perfect.
That's the one you'd like?
Yes, ma'am.
That'll be know where to go to get your labs.
Where am I going? Is it downstairs?
You're going to take this piece of paper when you get off the elevator stairs and get on the first floor. Look to the right, baby. There's two glass doors for Suite 100.
Okay.
Go in there. Hand this to the young lady that's at the check-in window.
Okay. All right.
You have a great day.
Yeah, that's the first room that I actually went in the first time I came here. So I know where it is. All right. Thank you. You too.
Thank you.
How y'all doing? Fine. Oh, this thing too slow. Weight 271.2. Blood pressure 123/83. Heart rate 100. Temperature 97.7. Pulse 99. Stop playing with me. Your girl is together, okay? Maybe we did labs, and when I say we did labs, we did full labs. We test for everything. Whenever we do labs, for that yearly, for that annual, for that wellness, everything. Got anything you could, STD, anything you could think about. And especially that cousin they got riding around here in the NOLA. Baby, how did I pull this out? I must have pulled this bag out. My thing out with my with this right here. But that's okay. We're gonna go ahead and fix that right there. We're gonna go ahead on and fix that right there. I'm gonna have to use my other phone to record because yeah, that too. Doctor's appointment, check. Labs done, check. Mammogram still need to be done? Yes. Cause why is that's the wrong one that's connected, baby. We're not trying to be connected to that phone right there. We're trying to be connected to this phone right here. We're trying to be connected to this phone right here, the one that we're going to do our orders on. And as a matter of fact, I think I'm gonna switch that around. Hey y'all might hear the air conditioner because I'm sitting right here, but I came on here to see the day wasn't productive. I did a few orders, baby. The rain was raining. It stormed. I took a little short nap, and that was about it. I took a little short nap. I did a few orders, came inside, took me a bath, baby. Took me a good bath, a nice long soak, shaved under my arms, hit everything up, did myself some justice, paid myself some attention, yeah, all of that. But I'm about to eat me a little something. It's these, oh my God, the plate is so hot. It's these like Better Goods. They some au gratin potatoes, and I put a little sour cream on the side. That's what I'm gonna eat. We have our one and only favorite robe on. Gonna always be, baby. Gotta get washed 24/7 because it's my go-to. It's the most comfortable one ever. It's way too big for me, and I don't care. It's way too big, and I don't care at all. Period. Don't care. But the day wasn't bad. Y'all, I chatted with my doctor. We talked about some things, We did all the regular, like I told y'all earlier, did all the blood tests and everything was good. She liked the way my numbers was looking. She was like, okay. She liked the page that I'm on. I was like, okay, period, sis. No, I'm just playing. I didn't say all that to her. But she cool. Love her down. Like, if I have a doctor that switch and go somewhere else again, I'm rolling with them. I'm not going to see other doctors in other places. And I will let her know that if you ever go somewhere else, you better hit me up and tell me where you're going. You better tell me where you're going at, because if somebody ever call me and say, oh, because my endocrinologist is leaving. She is leaving. She is moving and going to Dallas. So what? Do I need to move and go to Dallas? No, I don't, because my primary care doctor, I love my primary care doctor. But I love all my doctors. Like, I really have some really good doctors. My dietitian, she fire. She funny. She an older lady. She real cool. I like her. I think her name's Suzanne. Don't quote me. I might be wrong. But I came on here to say this. If you've made it this far, that means you watched the whole entire video. Thank you much, very much so. Appreciate it. Okay. And with all that being said, since you made it this far, make sure you give my video a good old thumbs up. Make sure you like it. Comment down below. Yes, because I, me, her, she do respond. Make sure you share my video. Make sure you share it with your social media people as well as your friend and them. Make sure your friend and them sharing it with their friend and them, with their mama, sister, daddy, brother, uncle, cousin, and grandpa and them. Yes, with everyone. But most importantly, make sure yourself, right along with all the people that you sharing it with, make sure you hit that bell. Hit the bell so you can be notified every time your girl, who, me, her, yes, Pretty Nikki. Every time I post a new video, love, because why not? Because why not? But with that being said, I'm gonna have to love y'all and also leave y'all. Good night.